cancer, for example, we can work in coordination with the head and neck surgeon prior to removal of the oral cancer by making the obturator in advance whenever possible. So the patient can have their prosthetic appliance fitted in the immediate post-surgical, avoiding the need of oral intubation for feeding. We can also intervene in the post-surgical by construction of the oronasal obturators or construction of a dentoprosthesis that will allow the patient to eat better, coordinating with the speech therapist, who will check for any nasality left without prosthesis. The team involves other specialties that takes care of the patient as a whole, such as nutritionist, the integrative medicine doctor, the psychologist, and whichever other specialty we find necessary to add to the well-being of our patient. There are so many areas where complementary health approaches can be incorporated into our daily routine. Thanks to photonic biotechnology, light and electromagnetic devices opened up a large field of opportunities from the areas of diagnostic with fluorescence to the treatment of conditions with photobiomodulation therapy. We play a fundamental role in the early detection of oral diseases, such as periodontal diseases, caries, and oral cancer, all of which can be enhanced with the aid of fluorescence. Light technology can be used to detect and treat diseases in real time. For example, fluorescence can be used to visualize biofilms in tooth and implants. Recent research has also made it possible the use of fluorescence to guide cancer surgery in real time, allowing for minimal reduction of tissues. We are the providers of early detection of oral cancer, preventative and curative treatment of oral mucositis and xerostomia caused by chemo and radiotherapy of patients with head and neck cancer. Now, the randomized clinical trials have pointed to that oral opioids are not more effective than other drugs in control of pain. Authorities are supporting the use of and development of alternatives for pain relief. Evidence-based literature supported use of photobiomodulation and lasers in the prevention and management of pain. We can use photobiomodulation therapy, for example, to manage acute pain and to offer comfort for many patients with chronic pain conditions, such as trigeminal neuralgia and other orofacial pain disorders. There is a large body of evidence supporting the efficacy of low-level laser therapy or photobiomodulation therapy for the management of mucositis in patients undergoing radiotherapy for head and neck cancer. And it's now the gold standard of care for this condition worldwide. Photobiomodulation can be used in all phases of care for mucositis and xerostomia, during and post-surgical procedure to produce pain and accelerate healing, prior to chemo and radiotherapy to prevent oral mucositis, post-chemotherapy to increase blood flow in the area and prevent necrosis, increase salivary flow, and to prevent, control, and treat oral mucositis and xerostomia. We dentists start with the prevention irradiation protocol before the patient undergoes the chemotherapy, and all the sessions thereafter are also carefully coordinated with the chemotherapy center and the professionals involved. Again, this required careful coordination between caregivers. We use a similar team approach in sleep medicine. We are also the core solution for consequences of sleep-related disorder breathing caused by craniofacial underdevelopment. Why and how? The American Dental Association issued a policy in 2017 policy statement addressing the role of dentistry in sleep-related breathing disorders. The adopted policy emphasized that dentists are the only healthcare providers with knowledge and expertise to provide oral appliance therapy. They stated the influence of sleep-related breathing disorder on potential serious medical conditions associated with obstructive sleep apnea, such as metabolic, cardiovascular, respiratory, dental, and other diseases. They outlined the role of dentists in treating sleep-related breathing disorders. They recommended that dentists assess patients' risks for sleep-related breathing disorder as part of a comprehensive medical and dental history and refer affected patients to appropriate physicians. Dentists serve as a front line to proper screening and education, and therefore can change the course of healthcare forever. The goal of an airway collaborative network, for instance, is to tackle the root cause of a deficiency and compensated human airway. This approach is a shift to the orthodox paradigm that uses specific techniques for treating signs and symptoms of conditions and not the etiology. Healthcare professionals together need to find the common cause behind the medical concern of their airway patients. Their visible symptoms need to be investigated with multidisciplinary approach. We need to do a whole body health and wellness assessment, which will include a sleep study. We now know that there are a variety of health risks associated with sleep and breathing disorder that may be resulting from underdeveloped jaws, such as headache, migraines, bruxism, mouth breathing, snoring, allergies, asthma, ADHD, bedwetting, chronic fatigue, aggressive behavior, anxiety, depression, dementia, hypothyroidism, fibromyalgia, cardiovascular disease, hypertension, obesity, diabetes, cancer. The multiple subconscious awakening present at the end of each sleep apnea, preventing the establishment of a structured sleep, increase the risk by 6 times of having a metabolic syndrome in children with obstructive airway disorder. This metabolic syndrome corresponds to the presence of a set of physiological signs caused by impairment gas exchanges, systemic and pulmonary arterial hypertension, increases triglycerides and cholesterol, as well as insulin resistance. People with metabolic syndrome are at a higher risk of developing diabetes and are more prone to cardiovascular disease. Cardiovascular consequences, heart rhythm disturbance, and ventricular dysfunctions are noted in approximately 15% of children with obstructive airway disorder. So what's really happening? What's the underlying cause? Is there a compromised airway involved? What other signs and symptoms the dentist can identify? Is there a narrow dental arch, tooth crowding, high volt palate, tongue tie, parafunctional habits, Are there other issues that needs to be addressed? Does the patient have a weak tongue, low tongue position, weak oral facial muscles? Is the patient presenting abnormal growth? Dark circles under the eyes, looking tired, narrow and small chin, dry lips, mouth breathing, lack of symmetry, looking sad. Are there symptoms linked to a compromised airway? Parents are the first to notice a problem with their children breathing while sleeping. Sometimes it's the pediatrician who notices a problem in the growth curve or weight gain. The dentist also can notice warning signals, such as the shape of the face, like a long face, mandibular heterognathia, macroglossia, large tonsils. We need to investigate the airway and not just look at teeth. What could be causing the compromised airway? Airway obstruction caused by underdeveloped jaw can cause many health issues and will need to be addressed by a team of healthcare professionals. The dentists need to search through a detailed questionnaire and examination of all the risk factors for obstructive airways. He will then refer the patient to specialists such as ENT, otorhinolaryngologist, or pulmonologist, a sleep doctor, to do further investigation of the nose, nasopharynx, and for a sleep test. Are there enlarged adenoids, abnormal septum, abnormally in the turbinates, inflammatory nasal sinus, rhinitis? Does he have apnea or upper airway resistance syndrome? Does the patient have a narrow upper or posterior airway that could be the root cause? We need to investigate. We need a CBCT scan to see the whole craniofacial structure and the airway volume. How did it get this way? Is a narrow upper or posterior airway preventable in children? Is it treatable in adults? We dentists are again in the front line of these questions. We must work towards identifying and treating the root cause of the problem. It is the dentist who can then address the treatment and expansion of the arch and of the narrow airway that could be causing all these symptoms. In the 21st century, we now have the tools to do it in a non-surgical and non-invasive way. This is a case report to illustrate an integrative multidisciplinary approach to